Hey, hi, it's Kit. So I am 2 weeks post-op with top surgery from Dr. Sassani down in Fort Lauderdale, Florida. Technically 17 days, so 2.5 weeks, and things are going really great. So I'm going to tell you a little bit about things. First off, I'm just going to show you my chest because that's what we all want to see. I have most of it still covered up for reasons. So I will show you my chest in full form once I get a little bit more comfortable with my nips not having problems. I'll talk about that in a second. And when this falls off, and then I put the silicone tape, I'll show you what those incisions look like. But turning straight into the sun, it is so flat. Look at that Christmas tree, just that nice parallel line. And then on this side, you can see a lot better. It is crazy flat. I mean, I wasn't like a big-chested guy to begin with, and so I went into surgery kind of going like, well, this is something that I want, and I don't want to have to tape anymore and bind, and like it's really frustrating. I want to go to the beach. I am beyond ecstatic about the results as far as like it is different. It's really different to be having something that is so compressed, so flat, so in the right position. Wearing shirts already, even when I have to wrap up with an ace bandage, still just flat, and it's great. So I would say like no dog ears, no, I really don't have problems with a lot of swelling. I have been wrapping with the ace bandage every single day since surgery, and I will continue to do that for the next 2 weeks just because I want to be on the safe side of everything. So results-wise, things have been going well, as you can see. As far as problems, we'll go there first. The only main thing is that this nip, I don't know, I'm pointing to it, you can't see it, the very center of the actual nipple itself is like soupy. It's like a yellowish color, and it's really soft. And I called Sassani last night like freaking out because it had stuck to the gauze and I thought it was just gonna fall out. And despite having some great resources on YouTube and like reading some articles and seeing some of that, but not really understanding all of it, it's just really intimidating to get major surgery and then feel like your nipple is about to fall off. So he said it's fine. It's like underneath all the skin is growing, and so even if it does fall out, the skin should still grow back and still mound or whatever. And just try to use a toothpick to try and not let it rip out and keep it there for as long as possible. But in theory, it should be fine. And if it's not, he's still willing to like do a revision. He's awesome. So I'm really hoping to avoid that. So I will tell you what happens, and I will then show you what's going on once I feel like that's safe. This side's much more normal. Whatever normal is, it's doing that whole like scabbing and peeling and getting pink and two-toned, multi-toned, and it's scary looking, but there's a little bit more out there about what that looks like, so I was kind of expecting this more. So my first huge piece of advice going in, or advice, not device, going into surgery is when the surgeon asks you what else do you want to know or what are your questions about, ask what to look for that might be problems. Because you'll know, he will tell you what to look for that are good things a little bit more, or he or she, sorry, but it might not really go over where like when to be concerned. And that was something that I think just myself being a little anxious anyways and really observant would have been helpful to know, oh, this has now reached a level of concern. So I recommend knowing those ahead of time if you get the chance to, and writing them down, because you're so happy when he's like, even like the first day wrap up, like, I'm out of surgery, you're kind of on pain meds, you're hoping the person who's with you is listening, but write it down. So that's the first big piece. As far as like healing and what that has looked like as a process, I would say the biggest thing was my stomach. I have a lot of stomach problems, so I was kind of like, whenever it was like, you're gonna get backed up, I was like, that's never been a problem for me. My stomach's always really overambitious. So I didn't start doing anything for having that problem until after surgery. That was dumb. It was very dumb. Because it's a thing that when you're taking pain meds, you just back up. And I didn't get any kind of relief for that for like 6 days, and that sucked, to be like in pain and bloated and tight and not wanting to eat when you're supposed to be eating. I lost 11 pounds in 2 weeks, and I'm already tiny, so I think that just like really, as much as I was like really happy about my chest, my self-esteem just plummeted because it's so hard for me to gain weight, and to lose 11 pounds instantly was like, it's been really hard getting back down to like a super scrappy size. So, and I'm obviously positive about the future and gaining it back and all that jazz, and I'm eating better now. But for sure, take care of your stomach going into surgery. If you don't, or even if you're having a lot of problem, milk with magnesia and colace together as a combo will sort your stomach out. It takes a day to still process it all through, and it's not fun, but it will solve that issue for you. So hopefully that's helpful. Pain-wise, the first day, like getting out of surgery, that sucked. Just to be like, I've had surgery before, so I was expecting that more. Day 2, I traveled back to where I live, which is a couple hours away from there, so traveling in the car was not fun. And I was on like the heavy pain meds for probably about 3 solid days, and then mostly to just sleep. And then I did Tylenol for about the week after that, and that seemed to keep things very manageable. And I take Tylenol in the morning now and at night to help sleep, but I really don't take it other than that. So I would say 2.5 weeks out now. I haven't taken it since, I don't even remember. That's been fine. It's weird to regain sensation, but it's not painful after the first week. First week painful, and also like getting more range of motion. Like this is probably as far as I would go up right now. Before it feels like it's any kind of pull, and then I obviously would stop, and if there's no pain, I could go higher, but I'm not going to go higher because I want things to stay not stretched out, which has been the other hard thing, is just as the pain isn't there to remind you to not be dumb, you have to tell yourself to not be dumb and like take it easy, because not only do you not want your scars to stretch out, but also there's like muscle, and there's nerves that are reconnecting, and your body is mending, so like give it the chance to breathe. So yeah, issues with my nip was the first thing. Stomach problems after surgery, and pain has been pretty manageable. The only last thing I'd add in is just that I wasn't really expecting dealing with some more dysphoria post-surgery. I didn't really get hit with the post-surgery depression that came with, like, I don't regret what I did. I'm super happy. I've had no issues like looking down and be like, oh, I miss my old body. I don't. This is amazing. It is so confirming for me and really awesome. So, but a weekend I was like watching shows, to heal or whatever, and I started getting all this like, I have bottom dysphoria generally, but like over the top dysphoria about just like not being born a cisgender male, and like, having babies, and like just crazy amounts of things I don't think about very regularly were coming up a week into surgery. So, 2 solutions for that for me anyways was just one, I hadn't been packing because I was mending and I was at my parents' house, so I didn't really feel the need to do that, and that solved things, a lot of things. I started packing about a year ago. I don't think I realized how much that actually helps me until this happened, and then I packed again, and I was like, this is just, I don't know how to explain it, I don't get it, I don't know how to explain a lot of this, but it helps. So that was big. And the second thing was just like, as much as like going through this made me terrified of the possibility of how painful it would be to maybe consider doing surgery, like lower surgery later in the future, and like the implications of all that, it's like, frankly, just like stop. Like that is the least helpful thing you could be doing this moment. I'm already so happy with the results of this, even though I was in pain. It was for sure worth it. So that's probably how I'll feel later, if that's the road or the bridge that I cross. But moreover, you're healing from a major surgery, so like thinking about the next huge one or whatever isn't healthy. Like it's not healthy to be putting that kind of negativity or that kind of fear when you're already dealing with big things. So I just frankly told myself anytime I would get to those places to try and to use my ADHD to my advantage and distract myself with something else. And that, I think, 2.5 weeks in, has been better. I've been a lot better with that. Last 2 like really fun things, not fun things, but like weird things. I had a lot of like these crazy bear mark. I think you can maybe, perhaps not, see, that's normal. Like it looked like something had just ravaged my chest, but it was just from binding so tight that first week. Those have cleared up, so now now it's really just this. But that was weird. And then 2, I had to shave. You have to shave your armpits because they put tape all the way up in there. Maybe not every surgeon recommends that, but mine did. And that was weird. It's been weird. Like I have not had hair in my armpits for a long time. And, like growing that back and having it be itchy and like sweaty when you're already uncomfortable, it's not fun. Other than that, it's been great. So I will do a whole nother thing about like what these look like when I feel like this isn't just gonna fall off, and about insurance too, because I have had some struggles with them and fighting. I'm currently fighting with them about the whole thing. So I'll explain all that later on. If you have any questions about specifically like day-to-day pain or what I did or anything like that, always, of course, feel free to reach out. Yeah, thanks for watching.